KSMO Radio. It's time for our spotlight on the Salem Memorial District Hospital. We have JoeAnn Hammond with us this morning. How you doing?
I'm doing really well, thank you.
Good. Glad that you can make it in. A little bit delayed this morning, but that's okay.
Yes, we apologize for that.
Oh, that's all right. That's not a big deal. Just want to make sure that everything is okay. You know, obviously, a lot of times there's meetings at the hospital that last a little longer than anticipated. Does that happen?
Every once in a while, we've been pretty busy here of late. So
Yeah, I hear you. So very good. Anyway, a lot of different things are changing. So while we have you here, let's just go ahead and start knocking some of this out. Don was his courtesy was extended to a whole bunch of people at the board meeting come Tuesday night. And the neat thing about it is he did a nice summary, a nice kind of wrap up of the first 90 days with Bill and everything going on. You want to touch on that a little bit?
sure, we have made great strides in studying our cash flow, improving how we monitor our cash flow, and being able to extend our days cash on hand. We have turned around several billing processes. We are getting a unity in our family medicine. You call and you don't, if your primary doctor is busy, any provider that is available will take you right in and see you the same day, most times.
That's really good stuff. We want to touch a little bit about, obviously, Don went over a number. I keep thinking, Bill's not here.
He went back
to
home.
Oregon. That son of a gun. Anyway, but nonetheless, different things. Everybody knows when somebody takes over and there's a change of hands or a change of management strategies or styles, there's going to be some changes. First off, an old copier contracts. The hospital's had some old copiers and
Yes.
old copier contracts. And they become less efficient the longer they go on. And obviously it was reported by Don that the hospital was able to save some money on that, right?
They did, and we're really excited about that because what had happened over the years, we had, I think, 5 different contracts for copiers all across the hospital as we needed new
Different
copiers.
companies or the same companies?
Same companies,
Okay.
but we had all these different contracts
see.
and still. So we were able to roll all of that into one at a significant savings. You know, every little penny helps. So if we save
Sure.
$6,000 a month at the end of the year, we're saving $72,000. So.
Okay, I'll take it.
Yeah,
You're going to
we-
force it on me, I'll take it.
And it's those little changes that we've made all over in all of the departments that they seem like a small amount, but they add up.
Exactly. You know, I did in college, I was doing my thesis was on transfer pricing in between corporations, and I centralized on General Motors and how many different, every individual part of that corporation had to show a profit. So
Right.
they obviously, if the lowest one on there says they made a widget for $1, well, for them to make a profit, they had to make it $1.10 or $1.15 or $1.25. Well, then that goes to the next level, and then they do their thing to it. Well, now it's $2.30, and so it just keeps getting bigger and bigger and bigger. But that profit has to keep being built in, right?
Yes.
Because you have to survive, and
Yes.
you're gonna be graded on or reviewed by how much profit you make. So if you don't make any profit, well, you're probably not going to be around very long. So that's one of the bottom lines of business. That when I did transfer pricing, you know, you find out some realizations that kind of scare you. I didn't know that was out there in the real world, but yeah, it was pretty interesting. So a lot of that, like you mentioned, every individual department, you've got contracts for copiers. Why? Why not one with a hospital?
Right.
Makes
And
sense.
so we've corrected a lot of just looking at simple things like
Okay.
Pyxis carts. We have them in 3 different areas. Well, in 2 of the areas are secure, so why not put those on shelves and in a locked cabinet? It doesn't need to be a cart, and that saves us
Sure.
$500 a month. But over the year, there's another $6,000.
We just got started, actually. You're good.
Thank you.
You bet. All righty. Ashley Sullins has joined us, and it's good to have her along. You just go ahead and take your time.
Thank you, Stan.
I just want you to feel comfortable.
Okay.
No, well, I know
We
a
can
lot of
start
times.
it now.
Well, a lot of times you get in, you don't really know where anybody else is talking, and so it's just trying to catch up. All right, so very good. Don did mention about the new vision, the medical detox, and Suboxone Clinic. The hospital's looking into this. They don't have any decisions made or anything, but they're interested in looking into this possibly in the future.
We are looking at it. It's a great revenue generator, and it would be a big help to the community. You know, unfortunately, I think every community suffers from some type of drug abuse and affliction, and here, you know, in these smaller rural Missouri areas, we seem to have more than our fair share.
Or it gets brought out a little bit more because there's less people. So if it affects one or two, you're actually affecting families.
Yes.
And it really does bother people. And I get that. I really do. Ambulance update. Well, we've got 5. I will call it we have 5. We actually probably have more
That's generous.
Yeah, we actually have more like 4 that are operable. But anyway, nonetheless, some of our ambulances have shown some age, and they have some miles on them, and it's probably time to replace them. Hospital's been looking into this for the last, 3 years, I believe. Ashley could correct me on that, but the prices of ambulances have just skyrocketed, and they're out of the budgetary means that our hospital has.
They are. And the bigger factor in that is, you know, there's a 2-year lead. Just like you can't go out and buy a car off the lot that you want. There's only so many chips available. There's a 2-year lead time to have a new ambulance built. So it's something we have to look at, either putting those in the pipeline at least, so that when it is time to purchase a new one, we can get our hands on one.
But you're searching for a quality used one at this time, if
At
one
this time.
becomes available. Very good. All right, so the employee pharmacy, this is something that, didn't the hospital have this before, Ashley? They did? Okay.
Yes.
So,
It's
all
been-
right,
it's
so
been
this is
several
not
years.
something brand new, but it's something that's been revived.
It is. We
Okay.
are hoping, you know, currently we spend about $60,000 a month in prescription costs to our employees because cost of drugs are high. And so if we brought the pharmacy in-house, we could run it through our own 340B program. We are looking at saving about $40,000 a month by implementing that, but also a huge cost savings to the employees themselves, because we had to raise co-pays and how much is out of pocket for our employees. So if we bring that in-house, we can reduce that and save not only the hospital money, but save our employees money.
Exactly. It's very, very important to do that. Very good. Strategic planning. This is something that previous boards have done. They've actually gone away and done a 5-year strategic plan, 3-year strategic plans. I don't know. Were you ever involved in those? No.
I have not
They
been
left you
yet.
behind, did they?
Yes, I wasn't around
Bunch
then.
of dummies, right? I'm just kidding. No, but actually, they put together some pretty interesting plans over the past few years. And this time, though, Don wants to do it a little bit different. He wants to involve some of the community leaders. That was never part of the hospital's strategic plan. And if I don't want to quote him, but he wanted to get patient side of this. He wants to get the consumer side, and not just what's involved in the hospital, because sometimes when you're in it, you can't see the forest from the trees. You really need somebody out there to show you, hey, there's light over there, you know?
Yeah. So we are looking at getting a committee together, the hospital staff, you know, generally the board of directors and hospital administration and the doctors would go somewhere and they would spend several days and come up with a plan and a vision moving forward. But I think we're going to approach that differently and bring it all in-house and involve the community. What does the community want to see happen? What are their needs, and what do we want to do going forward?
Seems like a logical plan, especially with the restructuring and what had to be done with the lab and everything else. So this makes good sense to do it right now.
Yes.
Because perfect timing. All right. Also, the NRA contract the hospital had for collections, not anymore.
Not anymore.
They blundered.
They did. You know, they just stopped collecting money. But worse than that, because, you know, the hospital needs money to survive. But worse than that, they violated our oath with the community in that they cold called and rotodialed several hundred people in the community and upset them. And that's not what we're about. You know, yes, you know, we have to get the bills paid in
Sure.
order for us to survive so that we can provide care. But there's a tactful, polite way to go about that. And so we immediately, once we found out what was going on, we got rid of that company, and we went with a new company that we have signed on, and there was no lag in that. As soon as we were addressed with the problem within 24 hours, we had severed our ties with them.
And it's a company that RHG is familiar with.
Yes, yes. ITX has worked with RHG and worked for all 4 of their hospitals, and they do a good job. And in their mission statement, in their contract, it's about quality of conversation and being polite and respectful, and they mention that in their contract. So that's a good way to approach it.
And the other thing was the results that NRA was giving were not much. Was it $500 was the last
$500
report?
for the whole month was all that was collected for us, but yet they didn't reduce our fee any, which was more than $500 for the month.
Okay. Well, yeah, all right. So happy trails, right?
Yes.
Happy trails. Very good. All right. So a little bit about what Don was talking about too. Some future hope things maybe in the summer would be to expand the clinic hours to weekend hours. And that's something that I know he would like to see done. Obviously, it just doesn't happen overnight, but this is something that he's looking into, experimenting, seeing what we can do, because obviously you're going to have to either get a couple new FNPs or something else to run those hours. But it's something the hospital is very interested in doing for the community.
It is, and I think the summertime is the perfect time to kick that off. We could get established with hours. It's a good area to come float and have camping, but also accidents happen on the river. So if we could have a walk-in clinic, it will reduce people going unnecessarily to the emergency room.
Right.
The emergency room is great, but it's not always the most appropriate place if you just need a few stitches, or if you've bumped your head and you just need checked out, or you have a tick bite. So.
And as anybody should know, in emergency room, it's priority. So if there happened to be an automobile accident, you come in and then they bring in 2 or 3 people from an accident, they're going to probably be a priority. Or if somebody should have a cardiac problem or a stroke or something of that nature, you could end up waiting for a little while for something that's very minor that could be taken care of in a clinic quickly.
Right. We had I believe we had a patient once who, unfortunately, due to circumstances, they had a fish hook in their finger, and it wasn't a priority to the car accident. And so you wind up having to sit where it's not, if you go to a walk-in clinic, you can just simply have that removed and
Right.
patched up or taken care of.
Very good. So you also had a chance to have the fine people from PKD come in and work with you with the books, but not many adjustments had to be made.
No, I had some questions about where some things were on our balance sheet, and we worked through those, and we looked at our contractual model to make sure it was up to date. That's something that we're going to go in the future, review quarterly. In the past, historically, we've reviewed that once a year, and it can cause a big adjustment at year end. And so looking at that on a quarterly basis will keep our books just tighter.
And at this time of year, and anybody that's familiar with our hospital knows that usually right after the election, you start to get the board actually starts on the budgetary process for the next fiscal year, which starts July 1st. And with obviously RHG being there for the first time and the changes that have happened at the hospital over the past year, this is not going to be an easy year to put a budget together, is it?
It was not an easy year to put a budget together.
I'm sure it's not totally finished yet. There's still some tweaking going on, right?
It is. We presented to the board our budget plan for the year. There's some adjustments and just some future looks at what we can do for improving capital wise. So we have some money to do some much needed capital repairs to the hospital. And so we will present the final budget at the next board meeting and have that signed off on, and we'll be ready for the new year.
And in all honesty, and in defense of RHG, you've only been there since basically February.
Yes.
And to learn a campus, the entire campus, and what needs to be done, the different departments and things of that nature, that's virtually an impossibility to get done in 2.5, 3 months to prepare a budget.
It
You've done
is.
a great job.
Yeah,
though.
but I mean, but to get an accurate, but you can't do it because you use a lot of previous numbers.
Yeah.
You
And
know.
I will say about JoeAnn, she has made this look easy from the outside. I know she's put a lot of work into it, and she has done a fantastic job.
I don't want you to hurt your back.
Oh.
Just talk to us. There you go. All right, now you.
Well, thank you,
move
Ashley,
it
for
wherever
that.
you want.
Yes, she
Yeah.
really has. She's done a fantastic job.
Well, very good. So, for the most part, I think that's pretty much everything I wanted to talk about. What we had the introduction. Don gave it was a good 15 minutes of just basically a 90-day review at what RHG has done, which is great. Bill's back in Oregon, as we already talked about. Probably enjoying some nice weather, cool, breezy weather. Probably not going to storm up there today, but we're going to probably see something. But it's always a change, and when you make that changeover, there has to be some adjustments, and that falls on you, JoeAnn. I guess it's just nothing else to do during the day.
Well, no, we're not busy at the hospital at all.
Not at all. Not at all. All right, no, very good. All right, so let's talk a little bit about some of the numbers. You went over this very good. Some numbers do stand out when you look at April of 21. Now, we do know there's a little bit of COVID back then again that we had a little pop-up in, but still the numbers that are outstanding is the swing bed change and also different things there with the med surge, the increase in those services, the increase in the average length of stay as well, and also in the acute care patients per day. All that has gone up in the last month, right?
It has. Ashley and her team have done an amazing job of taking care of our patients, even though we're short-staffed on nurses, and so we're everybody in her group has stepped up. All the managers have stepped up and taken shifts, so that the quality of care that you see has not changed at all.
It's got better.
It has.
It's gotten better. So when you see a swing bed numbers, and what we're talking about is 172 as compared to 45 last year, and that's a huge amount. Even a budgetary amount of 102, you exceeded that greatly. And swing bed is a moneymaker for the hospital, isn't it?
It is. The fee that is associated with that is a great revenue generator, but it's an important service that. Those people can stay here locally and they don't have to be sent somewhere else for care, and they're getting excellent quality care. Their family members, because we've opened the hospital up to visitors, can come and see them and check on them. And you're not having to drive a long distance to get the same quality of care that you would get somewhere else.
Exactly.
And we're hoping as well with this program, and we've seen it grow tremendously in the past 3 months. Our goal is to have 6 patients per day, and a lot of days we exceed 6 patients in our swing bed program. But also, with putting them in this program, it's going to reduce probably the readmissions that we see in the future as well. And that's one of the areas that we want to focus on, too, is our readmission rate for the hospital.
And you are scrutinized on that readmission rate, aren't you? So I think people probably don't realize that. Oh, I want to go home and get home and have to come be put back in the hospital. That reflects on SMDH.
Right.
Even though they may have insisted, like I did when I had to leave, that I need to be out of here today. And that was actually against medical advice. They wanted me to stay an extra day, possibly 2. I said, sorry, I have to go.
Right.
But so when you make those decisions, remember, it's not just your decision you're making. You're also, if it could be affecting your hospital and how they are viewed for payback on dollars eventually. So think about that too, because if they're asking you to stay an extra day, there might be a pretty good reason.
We have a nurse in the building that specifically monitors that each day on all of our patients to make sure that they qualify and that they have a qualifying stay. And so if we're recommending that you stay, it's because you still have a reason. So that's exactly right.
Very good. All right. So but the average length of stay up to 4.38 on the acute care side. I don't even remember the last time we had 4.38, Ashley. It's been a while since that has happened. But what it tells me is, though, the people who come into the hospital, they're sick and they need attention.
Yes.
So, a long time. Let's move on as the outpatient registrations still down.
Still down, and I think most of that is due to our labs, which, CLIA has all of our information, and they're supposed to be getting back to us. We're hoping before the end of the week that that's certified, but we are doing, I think we're at 90% of the tests that we can run. And so as soon as we're certified, we will be getting that out there and sharing that with everyone.
We want our lab to be fully functional. I know everybody does, and that way all the tests that you need to have, you can have them right here. But there is something brought up that by one of the board members where some visiting doctors and different things have in the past actually sent Salem patients to a different location for blood work. And I can understand that right now. But it's happened in the past. Even we had one of our own physicians doing that, which I was shocked when I found that out. But anyway, nonetheless, but the lab tests that are going to be performed here in Salem are they exactly the same as they're going to be at someplace else, and more than likely cheaper.
They are,
Yeah.
yeah. We, our new Vitros machine is state of the art. It's brand new. It's, it's going to be an accurate and reliable test that you don't have to spend an hour on the road just to have your blood drawn. So,
Yeah, and
with the price of fuel, that's something in itself.
well, yes, it is, and definitely something to consider before you do that. So the lab test a little bit down. Obviously, in the year before, very high. We tried to get in the always had in there the February test and different things that are going on. And a lot of times in the springtime, we had the health fairs that were actually held in the hospital. Well, can't do that yet, but they're looking forward to that health fair coming up, hopefully in June. But the dates have not been announced. I said, but
They have not yet.
Yeah,
Us, like every other hospital across the nation, are struggling with staffing, and then you add in a small rural area where there's not a huge population to pull from. Staffing's hard, so until we do have 2 more lab techs coming on, we have one starting Monday, so get them fully trained in our policies and procedures, and then we're looking at getting that health fair going. It's a huge savings to the community, and it's something we enjoy doing. So,
and it's a wonderful donation of the hospital back to the community. It's an investment into the community, to the health of our community.
Yes.
And getting people aware of where they stand right now with that health care. And that I can honestly tell you, I didn't miss it. I missed, I think, one in the last 7 years. So, it's a great photograph of where you stand. If you keep them all, you can actually see where your progression is and how things have changed. And I think I have them all the way back to 1999.
that'd be
Things
a
have
stack.
changed. It's a stack.
That's the year I graduated, Stan.
Okay, Ashley. Thank you. Appreciate that. Thank you. Make me feel younger every day. Thank
I'm
you so much.
just giving you a hard time.
I know you are. You're doing a really good job of it. One of the nice things about our hospital is we have some of the best radiological equipment around. And when people say to me, "Oh, I'm going to go get my MRI in St. Louis," I said, "Why? You've got a better MRI here than you will get in St. Louis because ours is brand new. It's got a nice open bore on the MRI. You don't have to get squeezed into a little cylinder." And I said, plus you don't have to drive a 4.5 or 5 hour round trip.
That's correct. And Bobby and his staff do an amazing job. They're friendly. You get right in. You're not having to sit in a waiting room for an hour just to get in the machine. They do an excellent job of scheduling and getting people in, and we have a brand new state-of-the-art machine.
Absolutely. And we've got great CT work done as well because that's brand new coming in too, right?
I just got the contract yesterday,
Yeah.
and so we're getting ready to sign that, and we will have a new CT. We're hoping by the end of the summer it's in place, up and running, and it's going to be great because before there was a weight limit, and not all of us are skinny minis, and so we're going to be able to treat even a larger patients.
Right.
And the big help to that is it has the ability for the staff to use the machine itself to reposition people so that the staff is not tugging and pulling on the patient.
Okay. Yeah, that's great. Ultrasound equipment, relatively brand new. Again, within the last year and a half, 2 years, it's all brand new. And of course, our X-rays, again, virtually all brand new within the last 2 to 3 years. So you're right up to date. It's all digital stuff. Everything that you need, you can put on a flash drive and take it with you if you
Yeah.
needed to. Instead of, remember the old X-ray packets?
Yes, I do.
Carrying those out. It was different, but it got the job done. But anyway, radiological procedures, pretty much right on track with where budget was, a little bit down from last year, but still good. And again, if you need anything done like that, do it here. I'm going to tell you something. You're going to save on the cost. If you compare it with your insurance company between here and St. Louis, by half price.
Yes.
Half price. And if you have a deductible that you've got to pay, that half price means a lot of money.
Well, and we have cash pricing for several of our
that's right. Well, I
radiological
was-
procedures, so it might be cheaper just to pay cash than it is to even pay your
There you go.
deductible.
I was going to let you talk about that because I was going to say something. I thought, you know what? I'm letting you guys do that. Not that Ashley would know anything about that. Not that you live with a guy that doesn't. It might be a big bonus in your cap for that.
There you go.
Get him some business. Settle down. Get 2 for 1. No, we're not going that crazy. But definitely, if you need a service like that, if you've injured yourself, and I'll tell you, don't put it off. This is something that is not to be played with. I found out the hard way. You tear a rotator cuff, you let it go too long, it starts to heal on its own, but it doesn't necessarily mean it's going to heal the right way. And that is not good when you get the scar tissue in there, because to heal it, then they got to go and rip that scar tissue back open.
Yes.
Not exactly something you want to have done. So be aware of your own body. If you trip, fall, do something, see maybe you just don't know what's happened to your knee, maybe you twisted, maybe you got a sudden pain in there, give them a call, find out what it's going to cost, and it might be very, very affordable for you to get at least an idea of what might be there. And when they get it read, get it back to you, and they say, yeah, you've got a tear, you've got a little of this, you got a little of that. Nice to know what you have rather than not know what you have. Very good. Rehab's been very busy.
They have those. They've been just knocking it out of the park, seeing patients and making everyone better one visit at a time.
748 visits, 33 surgical procedures. That's up. It's good to see that. Home health down a little bit, 175 with 11 admissions on that, and still 17 in long-term care. Do we find
Yep, we still have 17.
still got one
We have a
opening?
potential for the 18th admission,
Okay.
but it's going to be a little bit before we get confirmation. So we're
But as
working
of
every
Tuesday,
day on that.
it was 17. So
Yes.
Very good. All right, emergency department, and of course, emergency room. Seems like summertime it gets busier. So if you're going to be going out that way, as JoeAnn mentioned, you're down floating, you can get injured. You can get injured pulling a canoe out of the water, trip, fall on the rocks, scrape yourself up, or you're just out there playing ball and somebody hits you with a bat.
Yeah, really.
These things all do happen.
Well, let's hope nobody's hitting anyone with a bat.
Not intentionally. Well, I mean, you swing and throw the bat, and it might hit somebody a little bit. But anyhow, a lot of different things happen in the summertime. And as we mentioned, the emergency room is there for you. 625 visits in April, which was up from the year and up from budget, so that's always good. We do want to remind people that if you do go to the emergency room and they recommend to you something and you don't take that recommendation, they're not going to keep you there against your will, but you are leaving against medical advice.
That is true, and I think sometimes people have to just understand and be patient, and so, in some of those instances where people leave against medical advice, sometimes people, it's hard to hear that maybe you do have an issue that you don't want to face yet. So
There's a lot of that we don't want to face yet. But again, think about it, because the long-term consequences might be worse than that short-term response to whatever you're told. It does happen. And again, if you do go to the emergency room and you thought it was big enough to go to the emergency room and you have to wait just a little bit, don't just pick up and leave. If you thought it was bad enough to go, why would you leave?
yes,
And our wait times really are much shorter than other areas.
Oh, yeah.
in other surrounding areas. So I think patients think that they're going to go down the road and get right in, but that's not always the case. So We have to triage, and if there's sicker patients in that waiting room, we have to service them first. And so that's a lot of what we see with the AMAs is the ones that come out with colds and things like that, and they're waiting to be treated, and we have that heart attack in the ER that we're taking care of. And so it is an ongoing issue, but we're always looking at it and monitoring it.
53 admissions out of the emergency department, so you know that the hospital's there to take care of you. I've gone through that myself, so I know what that's all about, and trust me, they go through every single step and they do it the right way. Ambulance runs up here in April, and I tell you, a lot of patients transferred. Usually it's about 33% where you have dry runs, not even near that this month. So a lot of patients transferred. Dry runs were down to 42 out of 215. That's under 25%. So that's a good number.
It is. And, you know, every time that there is an emergency call, that ambulance is there and they are sent out. So it's important to understand that we're here to serve the community, and that they sit there waiting in anticipation for a call just to get out and serve their community.
Right. And if there's a multiple car accident, more than one ambulance is on its
Yes.
way. And of course, if once the highway patrol responds, if they say there's no injuries, then back they come, and now you have a dry run.
Yes.
You know, so that's what does happen occasionally, but other times they make it all the way to the scene, and somebody might be injured and they refuse treatment. Well, it's still a dry run.
It is.
You know, but they can a lot of times take care of you right on the scene. If it's something minor or superficial, they can take a look at it. What people don't understand, and JoeAnn, this is what's so scary about vehicle accidents, as sometimes there's internal injuries. You know, when you have a collision and that seatbelt is pushing you back and pulling on you, and you get twisted, you can do some damage internally that you can't see.
Well,
and you might feel fine for the first hour, but then later that day you might actually be really uncomfortable because you might be bleeding internally.
Well, and not only that while your adrenaline is up, you don't necessarily feel all of the impact of that, but having been rear-ended at about 40 miles an hour before, you think you're okay, and then about an hour and a half, 2 hours later, when that adrenaline goes down, and then you can't move or stand up or walk or lie down because everything is seized up in your neck and back. You understand that, you know, if you would allow somebody to take a look at you, they are trained to palpate for, you know, maybe soft tissue damage, or they can look in your eyes and see that maybe there's something going on that you don't realize because you're still worked up over the accident.
So a lot of times it's worth the trip to just get checked out. Better to be safe than sorry, and I mention that because, I mean, if you go back to years ago, Dottie West got in an accident. She went and helped the other people and then died of internal bleeding from that accident, something that easily could have been prevented. But like you mentioned, the adrenaline's going, plus then she was helping other people. She was going and going and going, and pretty well once she got done and slowed down, it was already too late. She actually bled out. Yeah. And that's something. We don't want anybody to go through anything like that or be put in that situation to where you're facing possible life-threatening issues by just not taking advantage of a trip to the hospital. Get checked out. No harm in being checked out. It's not. Now, if you bump somebody at 3 miles an hour, you might be okay. If it's that 40 mile an hour one, I don't think I'd be sitting there saying I'm fine. that might be a little bit more.
Well, as human beings, we're just a little stubborn.
Well,
Yes,
we
I
are.
did say I was fine and went back to work, and about an hour later thought, "Ooh,
Maybe
I
not
don't
so
think
much.
I don't think I'm okay after all."
You know, yeah, we all have that pride thing. I can take it. I'm tough. Okay, sometimes that doesn't always work. Let's talk a little bit about the financials of this. Obviously, we're doing fun. We got $5 million plus cash in our reserves. Our days cash on hand 65. You brought that out. One of the things that you did bring out, though, and I thought was anybody who's been following us for the last year and a half knows that our actual cash profits have not been around since COVID. I don't think we've had one since COVID hit, and we finally in the month of April turned the corner.
We did. I think everybody in the hospital probably heard me scream
Yeah.
out in joy that for the first time in more than a year and a half, the hospital turned a profit. It wasn't a very huge one, but it's better than losing money month over month. And that's with no special funding, none of the government funding that came in. Truly cash collected, we turned a profit for the first time this month.
And let's qualify that because the reimbursement rate right now is not full.
No.
So we're not even getting full reimbursement for the Medicare prepayments that the hospital get. You're only getting 50%, right?
Yes, we are. So anyone who has Medicare currently, if the hospital was reimbursed $100, Medicare is keeping 50 of that.
Right.
And so with that 50%, we would have been super excited that we would have probably made about $500,000 this month. However, we did make some money, and that's the first time in a year and a half. And so that's saying something, that controlling our costs, and it's been a rough road for 90 days, and the hospital staff has been through a lot, and the community's been through a lot. But in controlling those costs and making some of those hard decisions, we're finally starting to right side.
All right, very good. Now, book-wise, it looks really good at $417,000. But that's book accounting.
That is.
You're talking about cash accounting, and it's always good to see that. So, very, very good. Now, let's explain a little bit, though, that the Medicare money that the hospital got, I think it was $3.5 million. Was it not?
Yeah, we
initially?
had $3.25 million initially, and that was back a couple years ago when COVID first started. And so initially, Medicare made those payments in advance, and there was no request to pay that money back for more than a year. At that time. But it wasn't free money. It wasn't even a grant. It was advanced payment due to the crisis and the pandemic. So initially they started recouping at 25%, but then effective April 1st, it kicked into 50%.
Okay, yeah, that's not a discount you want to be getting from the government, getting reimbursed. Okay.
No, well, they already pretty deeply discount the service that we
yeah,
provide,
yeah.
and then they take an additional 50% of what they allow us.
Right.
That cuts pretty deep when you're trying to run a hospital.
So one of the good things, though, that when you were mentioning is if the collections stay at the rate they're going right now, that by August that will be paid off.
It will be, and we will be. That'll just be that much more additional cash that will be collected. But the other side of that is, if you hadn't paid it off by September 1st, now Medicare was going to start charging us interest on that money.
Oh, wow.
So
Why
now
not?
we can avoid interest. We'll be paid off in a timely manner so that we can avoid that, and we'll have a positive cash flow again.
Wow. Isn't life fun?
It is.
Right when it hits, well, we'll give you this money. We'll tell you how you'll pay it back later.
Yes.
Oh, that's great terms. But it did happen. And unfortunately, that's, and let's put it bluntly, this is not just Salem Hospital that got this money. This is a number of hospitals that are going to be going through the same situation right now who are just recovering and getting back on track, that they're only getting reimbursed 50%. And then they're going to have to pay interest too, right?
Yes, there are several hospitals across the nation, across the state, that are in the same boat we are, or worse, because there was no planning on how to pay that back, and there was reduced patient volume everywhere due to COVID. People just weren't getting out unless it was necessary, and so if the patients aren't coming into the hospital, you're not making any money to support the hospital. However, you can't send your staff home, because what if there is an emergency? What if there is a crisis? The hospital doesn't get to close. It's not like a restaurant in town. We didn't get shut down temporarily. We didn't get to alter our hours. We're still there 24/7 serving our community.
But JoeAnn, in doing that, and Ashley can justify this because I know I was in the hospital at the time, the expenses of the hospital went skyrocketing because they had to have, I call them hazmat suits, because every time they had to walk in there.
And we're still suffering from costs from that.
And those
Mask
costs,
of,
masks, gowns, shields, different things of that nature, little footies and everything else that you had to put on. Which, when I was in the hospital, and I've said this before, I hated to even page the nurse when I needed something because I knew they had to put all that stuff on just to come in and see me for 3 minutes and then take it all off, throw it away, and then go back out and have to put it on again to go see somebody else. Just, I'm sitting there, what insanity are we in? Because that is just throwing money right into the trash cans were in the room. Just throwing it right. I'm sorry, I'm in business. I can't see that as being even logical.
Well, there wasn't probably not a lot of logic in it. However, due to patient safety, it's something you have to adhere to. And when there are shortages everywhere, people probably in the community don't realize that at one point, if we wanted a box of masks, we might wind up having to pay $75, but we can't operate without them, and we have to have them. So whatever you had to pay to get them in there to keep your staff safe, the patients safe, and control the spread of virus so that your staff could still treat patients.
Sure, and the normal cost of that box of masks is $3.50.
Yes.
And that's the crazy stuff. And that was the kind of the point I was trying to make as well, though, is that every time they threw one of these away, they have to replace that because there's another one they're going to have to use the next day or the next time I call. It's not that they can take it off and put it back on because they're coming in to see me. That's not the case. And that was what I was talking about of just being crazy because every time you page that, they had to do this. I didn't want to waste that money. I just don't. I mean, I'm just one. Hey, I can get by another hour. I'm fine. But they told me, don't do that. Just go ahead and... no, it doesn't. No. And I know how hard it was to get the stuff because, we're listening to the news and the price of it's going out of sight. I know materials management had to try and locate these things going through not only their first vendor, but maybe 2, 3, 4, 5, 6 vendors just to find some of the stuff. And then what's the cost you're paying for it?
Yes.
And you're not getting reimbursed full price for that either.
Yes, it's not like when you bill a patient, you get to add up how many pairs of gloves you put on to treat the patient or how many times you had to mask, cloth, robe, and disrobe in a paper gown or in a complete suit or, crazy things like the amount of hand sanitizer you can go through in a hospital.
How many 55-gallon drums you can go through in one day? I'll bet. But, but I guess when I see the whole picture and I was sitting there in that bed thinking, this has got to be an inventory nightmare. Oh, yes. Because you get 100 gowns in, and in one day those 100 gowns can be gone. And who's keeping track of every time they get called? I mean, I know they are, but, gee, it's just going to be crazy. It's insane. But it is what it is. We're hopefully past that, and not have to do it. Not that they don't keep inventory. They do. We're not past that.
We're getting ready to do that right now.
You have to do that.
We're doing that across the hospital as we speak. In something the size of a hospital and a clinic, it can take literally 2 months to complete inventory for year-end. So you just schedule and go from department to department and count it down.
And it's only good for that moment of that day.
Yes,
Because as soon
at
as
that
you turn
very
around,
moment in
somebody
time.
might need something, and away it goes. So it's only as accurate as the last time you counted it, and that's it. And I remember talking with one of the pharmacists years ago, actually Zach, before he went over to Dent County Health Center and went up to the lake. We actually talked about keeping inventory of the different drugs and the expiration dates on those drugs.
Yes.
He said, we have to have it there, but a lot of times we never even use the drug, and then we have to dispose of it properly, obviously. But then we have to buy a new one. Well, every time we buy the new one, it's always higher than the previous one before. But there's really nothing wrong with the one before, but it is beyond the date that they say it's a maximum efficiency. So you got to do it. And then you start thinking, how much money does that run where people don't realize that can be thousands and thousands of dollars just to keep your inventory current, and there's really nothing wrong with what you're throwing away. Gives me the weebie-jeebies just thinking about it. I don't even want to think about it. It's just depresses me. I mean, but it's a reality.
It is a reality.
That's the part of the hospital.
And the thing is we don't have the option to just run to your local Mosers or Vandevort to pick it up. We have to have it, if it's 2 a.m. on a Saturday and we need that particular drug, we have to have it in stock. So,
Exactly.
it's the strange things that we keep on stock that can be expensive, like snake venom. I mean, it's just not something you just get a script for every day.
Yeah. Well, no, you don't. But it's needed. But people don't realize how many different poisons are out there, different things that need to be treated. Like you're talking about snake bites, different kind of snake bites. People don't realize, oh yeah, there's a copperhead. Well, you got water moccasins, and in some areas of Missouri, there's actually rattlesnakes, and so those venoms aren't the same, and
They
they
are not.
have to be treated differently, and you have to have that treatment available when they come in. And it always is good to know what snake bit you. Just say I got bit by a snake, makes it a little rougher.
And it is the season.
It is the season.
Watch your step,
Not
right?
to be jolly with that, but
Be careful
but also
where you
tick
step.
bites and things of that nature. People be prepared because they can affect you, and it may not affect you until the long term with tick bites. It may take a while for that to actually creep up on you. Let's run over some of the financials really, really quick because I know there's a lot of stuff we still have to cover. Obviously, everything looks pretty normal. Accounts payable, obviously, that's all going to be there. Current liabilities, long-term debt. I always love what the hospital does because we pay down our debt fast.
We do.
And when you come to the current assets, you get a current ratio. You go to your debt equity ratios. Our hospital has been top-notch for 30-something years. We really don't incur a lot of debt compared to most hospitals. So to see it already down over $1 million over last year, that excites me a lot. So we've been doing something good.
We do, and we try to control, just through cost control. But there's no need for us to pay interest. It's a waste of money, and so you shop not only for a good quality item at a good price, but then if you have to borrow money to purchase that item, you shop for a really good rate, and you make great partnerships where we're paying very little interest over long term.
I call interest penalty money.
Yes.
It is. It's penalty money. They're charging you for something you need, but I need it now. I don't have that money. We're gonna pay. We're gonna charge you a penalty. So you're gonna pay, and the more you need it seems the higher the penalty.
It does.
Okay. So and I know a lot of people out there feel the same way. So yeah, right. And lease obligations have really increased at the hospital. We actually buy things in a long-term lease. It's a lease purchase option. You get it to the end, you can buy it, or you can turn it back in and move to the next newer piece of equipment, depending upon the length of the lease.
Well, and that's better than renting a piece of equipment because
is.
at least then you're building equity
Exactly.
in that piece of equipment. And, with technological advances, if we lease something for 5 years, at the end of that 5 years, it's probably out of date for the industry and needs replaced, but at least we've built equity into it, and that allows us to keep our equipment new and fresh.
And if you're replacing it and you can get that lease purchase option to buy out maybe at $1,
Yes.
some are that low, then you can sell it to somebody else for $500. You made $499,
You bet.
and that does come into play.
And a lot of times those companies that we're wanting to purchase the new piece of equipment from will buy it back because they have avenues for selling it.
Exactly. So anyway, good stuff on the balance sheet. That's always good to see. And the income statement, as we mentioned, we had a nice gain from operations of $417,000. But as I mentioned, don't take that as dollars. That's not actually cash with depreciation, different things of that nature. Some of that is a non-cash income with contractuals and everything else.
Contractual modeling is something that's hard to wrap your head around until you've had to do it.
Yeah, I'll bet. And I don't want you to try and explain it either. We only have about another 25 minutes. And it will take you a good half hour.
People would stop listening if I tried to
they
explain
might.
that.
They definitely might. But one of the things I know that the hospital is trying to do is get away, hire their own people, get away from having the traveling nurses, the traveling lab techs, and things of that nature. They'd rather have their own people in-house to do the job, and that will save money in the long run. The price of them is a lot lower, but also they have more of a vested interest in the hospital.
They do. We have some excellent traveling staff.
Great,
But,
yeah, they are good.
but the difference is, the person who's traveling and actually working for us, they're not seeing that big dollar because they're still paying their staff just
Sure.
like we would. The company that's staffing them out is really
Yeah.
seeing the profit in that. And so it costs us a lot of money when we have to hire travelers, but we have to stay fully staffed. We have to make sure that our needs of our patients are being met, and so it's something that, thank goodness there's companies out there to partner with that we can get the staffing available, but we prefer to have our own people invested in the community who have a connection with their patients.
Very good. And I love the analysis that you did with the dialysis. We've had one of the few hospitals will have a dialysis unit,
Yes,
and
it's very rare.
very rare. It used to be absolutely just jam-packed full. Not at the time we have now, but it used to be full. They had 3 shifts and they went 24/7. They were gone all the time, and that's been quite a few years back. So, but it costs money for that
It does.
dialysis unit because you've still got to be fully staffed there, and the amount of patients you have. And even if you are fully staffed or have a full capacity, you still may not be making much money, if
No.
any.
Well, that comes back to that contractual modeling. So the reimbursement rate for dialysis is extremely
Low.
poor and very low. And so, and with the advent of in-home dialysis, and I don't blame people. I mean, if I can do it at home, why would I come to a hospital? Other than you never know what is going to happen, and so you're right there at the hospital. You have nurses performing that instead of having to perform it yourself. And so if there is an issue, you have trained, qualified medical staff that can be right there to take care of you. And we have a whole hospital that can immediately run laboratory work and see if there is some other kind of issue. And sometimes, we're kind of stubborn and we may think we're okay when we're really not. When you have a licensed trained nurse administering that, they're going to see things that you are not
can't
trained
see.
to see.
It's eye-opening. I had no idea, and thank you for that. So, and I hope the board got something out of that too, because I don't think we really haven't talked too much about dialysis in quite a few years.
Well, and we've done some partnerships, and we're looking at opening that up, and maybe in the hospital's standpoint, we haven't done as good a job as we should have of explaining to surrounding communities that we are here and that we can do your dialysis. You don't have to drive to St. Louis. You don't have to drive past our hospital up to Rolla just to get dialysis.
And not only that, but people who want to visit friends and family in the area, if they're already on dialysis and maybe they're in St. Louis, you can
Yes.
call ahead and they can work a time in. And we used to talk about this all the time, and now it's been quite a while since we've talked about this, is that if you know you're coming to Salem or surrounding areas,
You
where
want to
it's
come
just-
down and float?
Right.
You don't have to drive 3 hours back to St. Louis to get that. You can come right to the dialysis unit here in Salem. Might be 15 minutes from where you are, and have to go through your treatment, and then you can stay longer here and stay healthy.
Yes.
And that's the key. You don't want to be coming down here and then have those toxins build up. That's not doing you any good. And then when you get back, you're really not feeling well at all. And so you can schedule that with the hospital. Just tell them, hey, I'll be visiting family and friends. Maybe it's in Texas County. Maybe it's in Shannon County. Maybe we're going to be at Echo Bluff. Staying for a week. Well, you're probably going to need a couple of dialysis treatments. So make sure you schedule that with the hospital. Just call the hospital direct, 729-6626. Ask for dialysis and talk to them and say, look, I'm going to be visiting. What steps do I need to do to set this up with you? And they will take care of it.
Yes.
That's simple. Isn't that
That's
simple? It really is simple to call. Probably
Call and
harder
we'll
on
do
their
the rest
end.
of the work, really.
Yeah, harder on their end than it is on yours. All you got to do is make sure you show up on time when they give you the time. Okay? All right, so JoeAnn, fantastic job.
Thank you.
And really appreciate all the detail you gave during the board meeting. And I love that report. So I love the different times reports I've never seen. I like those.
We want to share information that is previously, when I look at what we presented in board meetings, it's nice to see new things and new ideas and what we're truly hoping to do as a hospital and move forward to better serve the community.
But also to make the board aware, I think, of different parts of the hospital that they may not know just how the accounting of dialysis is. Accounting is a strange dog.
It is.
See, I graduated with an accounting degree. So, and I was in for not-for-profit accounting. That's what my specialty was. I really enjoyed not-for-profit accounting.
Well, would you like a part-time job?
No.
Are you sure?
Yeah, I'll give you the extra 5 hours I have a week, okay?
Okay. Well, right now, I'd take it.
Yeah, I bet you would. But it's probably been 40 years since I've done that, though. Might be
We'll get you a
bit-
good calculator.
There you go. That's all you need. But one of the interesting things is that people don't understand about fund accounting, is that basically some people try to narrow that down into fund accounting, is that it's still numbers. However, it's how you handle those numbers that make a lot of difference. And when you look at a dialysis department and where it stands on its own, as we kind of talk about that transfer pricing again, it's not going to be a moneymaker. And you have to determine how much money can you lose out of that department. And when it comes to replacing that equipment, which is not cheap, and we I think just got a new unit here not long ago. If I'm not mistaken, I think about a year ago we just got a new unit. Those are not cheap, but when you start looking at how do you justify that kind of money when you only have this amount of patients?
Well, and just the contract, we're required by law. So all the machines you see in the hospital, we have rules and regulations we have to follow, and all of that equipment has to have just regular preventative maintenance, just like you change the oil on your car. Well, just for 6 units, the cost for preventative maintenance and for those machines is $25,000 a year, just to maintain them, not to buy them, even if they
No
just sat there.
repairs. Right.
Yeah.
Right.
So, for us to stay in compliance, those things all cost money. So it's better to use the machines, get patients in there, get them seen, take care of the community,
Help cover
and
those
help
costs.
cover those costs.
Yeah, absolutely. And if anybody has never been in dialysis and you go in there, it's not something. It's a 4-hour treatment.
Yes.
And when you're in there and these people, they can't move, they really have to be just stationary right there. It's great to go in and visit some of those people because they're bored to tears. They're trying to read maybe or watch TV. But it's like, if you got, I was in there one time. I remember when late Dwayne McClellan was in there. We sat and talked for 3 hours. As I had no idea what dialysis was all about and what he had to go through every single
It's a
other day.
Right.
tedious thing to lay there in that bed, but our staff does an amazing job of keeping it clean, keeping patient comfortable, and just a really good collection of ladies who are very caring and would treat you just like they would treat their own family.
That's always been part of Salem Hospital. You're just like family.
Yes.
Be a great identifier. Oh, we'll let that go later. That's called marketing. We'll do that later. All right. So, Ashley, we're going to let you do things. Community health needs assessment. They finally got all it tabulated and found out what the community wants or feels or needs.
We formed a committee. 4 Rivers in town, Healthy Dent County, the health department, and we are partnered with a program called Delta Regional.
Right.
Plus the Salem Hospital. We've are working towards helping problem solve some of these healthcare needs that the community has identified. Some of the primary ones, we've identified 3 primary, which are cost of healthcare, substance and drug abuse, obesity in adults and children, and our secondary is lack of dental care. So currently we are working on an implementation plan. We'll get back together, put some of our ideas together, and start meeting regularly to try to help with these areas in the community.
Put together something that can address these needs as best as possible. You're not
exactly.
going to be able to eliminate them, but you
Looking
try.
back, every 3 years we are required to do
Right.
this, and this year seems to be the same things identified as problems 3 years ago. So we really want to focus on this and try to maybe improve some of these things and make a difference.
I think the one last 3 years, though, with COVID in there, kind of knocking things down for 2 years, not much changed.
Yeah.
And nobody can really identify anything different because we're all locked inside and we couldn't go anywhere.
Right.
So
Yeah.
whatever was there last, that was.
That didn't help with our obesity any.
No, it didn't.
yeah, it didn't. It really didn't. And boy, it was good to get out when it finally did. All right, I know you're always asked about the masking requirements at the hospital. That's a CDC recommendation, okay? But there are some requirements that the hospital staff has to go through. Too.
Yeah, and when state comes in and does a survey on us, they're going to want us to follow the CDC recommendations, and their recommendation is for us to continue to wear masks around visitors and patients. A lot of people see that our transmission rate is low in the community, or there's not as many cases, but we are still required to wear them within our facility and have our visitors to wear those as well to keep people safe.
Sure.
We monitor the recommendations daily, weekly, and we don't want to have to wear masks either. And as soon as they lift those restrictions, we're going to do away with them.
Absolutely. But we still have COVID in the community. There's still some cases that keep popping up here and there.
Sure.
So I think we had about 10% rate Tuesday. Wasn't that correct? A little, about 10.3 as
Yeah.
of Tuesday. I think it's down a little bit today, but
Yeah.
every day it's going to change, and then people say, okay, it's under 10. We can release that. We can relax that. I should say,
Sure.
not release it. Well, then you know what? All it takes is one person to come in and get COVID again. You're right back above 10%, maybe even higher.
Well, and one thing that the community doesn't realize that not only CDC recommendations, but as a condition of Medicare participation, we're told that if you want funded and you want paid from Medicare, you will put a mask on.
Right.
So
Even 50%.
even at 50%, we need those funds.
How about half a mask? Very good. All right, so moving in, I'll let you go ahead and take care of the hospital foundation too. Ray Bruno decided he'd be the foundation board member. Dennis Feilman had been that, I think, for years. Been on there, but Ray took that spot and he's filling that, so that's great. And the golf tournament,
June 3rd.
June 3rd.
I think how many teams, JoeAnn?
We're
14?
up to 14 teams. We're so excited we could use 14 more though.
Right.
So
Last year we had 28 teams registered. I know a lot of them trickle in at the last moment.
do.
So if you want to play golf on June 3rd, get with any of administration or Jason Edwards, and we will get you a team on the roster.
And Jason will be coming in. We're gonna do some stuff for the golf tournament.
Okay.
And one of the things that I made a mention to him, I said we're just not getting that word out about the golf tournament this year as we have in the past.
We got a little bit of a late start with
Yeah.
everything that was going on, but I think it'll pull together
we have some
nicely.
great prizes.
And that's what I want to make sure we get out there so people know what not only is it helping a great cause with the foundation, but first
It's a fun
lot
day.
of fun.
It
Yeah,
is a
and,
lot of fun, and hopefully
know.
the weather's nice. That makes it so much better.
we sponsor the hole-in-one, so you go out there and go knock yourself out. Get about 5 hole-in-ones. Okay, maybe not 5. That might cost me more.
That would be exciting to see.
Yeah, it would be so exciting to see, or it might make me broke. But nonetheless, but yes, we do that. We've thrown some Cardinal tickets in there, so against the Cubs, by the way. So
All right.
anybody that wants to do that, I gave those to Hannah yesterday.
Mm-hmm.
So again, there's a lot of great stuff going on. The golf tournament that supports the foundation. June 3rd. In the past, we have had 2 flights. I don't know what's going to happen this time. It all depends on the amount of teams.
Sure.
So we'll see how that all works out. Very good. All right, the marketing and community perception. We got some different things going on. I know that's been worked on a little bit. I know we're kind of in the process of updating that marketing plan, so we're going to continue to work with the hospital and try and get things up to date. I've got some ideas, but haven't had a chance to really get all that meeting in. I want to sit down with Don and Jason and whoever else wants to be
Yeah.
involved. I think Tabitha Stanfest
Yeah.
said she wants to be involved in that too. So just kind of go through a whole program so we can start addressing the needs that
Sure.
in the last few months have kind of, I won't say got just pushed aside. There've been other priorities.
Right.
that have taken place. So very good. Chamber Expo, though, on June 4th, Terry Bruno is going to be there. That's great. Good to see the hospital and having a booth there. And Michelle Bland, who was here yesterday. We talked with Michelle, and, she was just so down in the dumps.
Oh, I'm sure she was.
Yeah.
She's laughing most of the time. But no, she's going to be doing sports physicals down in Ellington and Viburnum in June and August, which is great. And those will be free. They're going to be free sports physicals. And of course, also, we want to remind people our hospital does a great job in working with large corporations providing services. Tim and Felgerson talked about the Doe Run contract, and that's they're working on that. They also made a presentation to the commissioners for Denton County to have that done. They take care of the city of Salem with their employees. So a lot of that is very important because of injuries you can sustain for workman's comp. You have to have a baseline. And if you have the baseline set, you're good. But if you don't have the baseline set, they can come in and say, I did this, I hurt my dad, It's to prevent fraud. That's the idea. So anyway, they did make a presentation to commissioners. The commissioners have not yet acted on that. They are talking with their insurance company to see, as I think Bill had mentioned to them, there may be some savings there on your workman's comp insurance if you tell them you're going to do this. So there you go. I updated you on that one only because I was there when they talked about it. So
Thank you.
very good. All right, Chief of Staff's report. Who wants to do the Chief of Staff report?
Well, we'll just jump in and do it.
Go ahead.
I think the only main thing to note there is that we approved privileges for Dr. Meyer, partnering with Dr. Garcia. So
Very
that was
good.
approved and recommended.
Okay, Margaret Meyer, MD, right?
Yes.
Okay, courtesy staff privileges there. We'll jump right into old business. You already mentioned about Clea coming in for the Vitros. Hopefully, fingers
Hopefully
crossed.
this week.
It would be nice to have it done by Memorial Day.
It would be.
Nice. And we're hoping. The lagoon closure and the city sewer project. So the city has run the sewer out to the hospital.
Yes.
The lagoon is not attached to that at this time, and neither is Seville, which is not there for that. And so right now, to try and get a bid for anything, any kind of service, forget it.
It is. The bids that we do get, they're not good for more than 10 to 14 days because of rising costs. But in the meantime, DNR came out and inspected our lagoon, and it's perfectly functional and operational until we can raise the funds. So the city brought the services and the lift station to us, but even just the cost of connecting to that is substantial.
Yep.
And then also the fee monthly is something that I did build into the budget. However, those are all additional costs that the hospital had not had to pay in the past. So.
Okay, so there are positives to have the lagoon out there, but we all know what DNR can do within a moment's notice.
Sure.
They
Yes.
just come in and say, I'm sorry, you're going to have to shut it off tomorrow. But they'll give you probably 60 days.
Yeah, well, they did just approve it for
Yeah.
another year
Sure.
so that we can raise capital funds to spend the money and connect to the city sewer.
But there's always that, because years ago, I remember when I was in real estate and they were outlawing lagoons now on properties because when there's runoff water over, when you get monsoons coming in,
Yes.
they run outside their banks, and so that's not a good thing.
Right.
So anyway, that's what they always worry about. And good for another year.
Another year?
Another year. We're good for another year. So very good. And that was approved by the board, by the way, to go ahead and pay that and extend that lagoon contract with DNR for another year.
Yes.
Very good. Transformer project. We're getting closer and closer and closer. Bids are due June 2nd. You want to bid on it, you can. You can get the specs from the hospital.
From
if you want.
Todd.
Yeah, you can get the specs, but I'm pretty sure most of us around here probably can't do it. But if you want
It's
to.
going to be a very large project, but a very necessary project.
The commissioners of Denton County with ARPA funds have committed up to $200,000 for this project, which is great because it's probably going to take every bit of that and more.
And more.
And more to get that. The board did approve, though, an easement for Intercounty to
Yes.
change that transformer out because it will be put in differently than it was the first time, which was
Long time ago. You know, when you place something like that and then the hospital continues to grow and you build around it, at some point, you know, you just have to pick it up and move it.
Yeah. Okay, let's go into new business. We got a couple of CEO applicants that they're trying to get the board to be able to talk with, trying to find the right day.
Trying to find the right day, and still searching. The one gentleman that had been voted on decided to stay where he was and keep his family in a bigger city, not understanding just what a beautiful place we are to live. So we are in search of a CEO again, but Don Babb, who has, goodness,
40
years of hospital, 40
to
60 years
60, I
of
believe.
hospital.
Yeah.
He started in 1960. It was before I was born. So
60 years, I believe.
And I'm much older than Ashley, so.
Not much.
Wow. I'm not going there at all. Okay.
But he has years of experience, and he came out of retirement to come and sit as our CEO. Just a wonderful wealth of knowledge and stability,
Yes.
and just
Positive.
a positive, gentle, kind
Yes.
soul.
Yeah.
You know,
Very nice man. He was here, I think, a
Encouraging to all the staff. I
Yes.
mean, we're
And-
fortunate to have him right now.
second. And his heart's in the right place.
Yes.
He wants the hospital to succeed. So you opened up the applications for CEO again, even though you're going to be talking with these two people. You opened it back up because
Yes.
you never know. There might be somebody else out there. after
There
And
that
we
might
have
initial
several
bite.
applicants, and they're going through those applicants now and trying to find out who is qualified and appropriate. And so I think they said maybe 5 or 6 possibly that they might
Well,
have an
and-
addition to interview.
You know, being a small town hospital, we'd like to find somebody at least within the state of Missouri
Sure.
who has a connection and understands the culture, the community, if we can.
It's always good to try and find somebody who is familiar with
Yes.
this style of hospital too, because you can't come from a huge major city and then come into a small town and say, well, we're going to do it like that, because that's not going to work.
Right.
No,
Just not
it's got to be a good mesh. But
Yeah.
you know, with Don being here to see us through, we have the time to find the right person, which is the most important thing.
Exactly.
Yeah.
Very good. All right. So Jody Gorman was in from Human Resources. I always like that. Human Resources. Isn't that a great name? Human Resources. What other resources would we have? You know, you guys don't. You know, do you have animals?
Well,
that-
we're not mining for mineral here.
Well,
so.
there you go. So anyway, but Human Resources. But yeah, I always like that. But Jody does a great job. 4 new hires in April. You've got 10 now in May.
Yes.
And she's finding the people that we need, and that's a hard job right now, isn't it?
It is a hard job. You know, the competition for nurses is crazy, as staff, as Ashley could attest to. Getting nurses, getting lab staff. There's just a shortage. After COVID, people are burnt out.
Yeah.
And a lot of
blame
them that
them.
worked 6 and 7 days a week, nonstop, and worked 14 to 20 hours a day, they're just worn out, and a lot of them have stepped away from the profession. And a lot had met an age where a lot retired, and so it's hard to find staff, especially in a small town.
Well, hopefully, I know Jody will do a great job in finding those people, but
They need us back. We're good.
you guys are whispering. I don't want. Okay. All right. So very quickly, there's still positions open.
Yes.
And you can check that out on Westville Hospital website, smdh.net. The position is available. You can submit your application, your resume, etc. on smdh.net.
Yes.
If you'd like to do that, very good. Or you can mail one to the hospital if you want to do that too. And,
Yeah, we'll take all applicants at this time. We are have several positions, registration, not just nursing, but registration, anything from CEO down to housekeeping.
There you go. But anyway, but you can see the more specialized positions that are open. They are on the website. They are listed. Pretty easy to see. So you can just go
And we
ahead.
have sign-on bonus and recruitment.
For nursing and lab.
Even for that 5 hour.
Has to be
Job?
full time.
That it has to be a full-time job. You have to sign a commitment
Yes.
and a
That's
contract.
right.
So,
If you got that big bonus.
but I will gladly teach you how to do payroll if
I
you'd
know I
like.
can do payroll. Trust me, I can do payroll. That I can do. And as long as I don't have to come out of my pocket, I'm good.
I'll get you covered there if you want to come help me,
All
Stan.
All right, very good. All right, let's move on to the clinic update. Tiffin Felgerson was there and kind of gave a update on the kind of the change of the atmosphere down at the clinic and different things that they're doing. And what I got out of it, and you guys can correct me, first off, working as a team, but it's not just team, it's respect and the dignity that they want to show for each other as well as the patients and the image of what the hospital should be.
Yes.
And that's all very, very important to them, and then the quality of service that will follow from that change in attitude. I think that really sounded very enticing. And I know I was up there, and saw Shelley Bland, and it was already different. You get out with it because I kidded when I made my appointment. And I said, so I can come in when? They said, when do you want to come in? I said, how about 1? Okay. I said, so if I come in a little early, you're going to give me a popsicle? And they said, sure.
Sure. We'll give you a popsicle. We'll give you stickers, too.
Yes.
No,
we have
they
lots of
gave me a popsicle.
stickers.
They
Yeah.
gave me a pickle pop. When
Oh,
I got
my.
done. So,
I'm not sure about that
yeah,
one.
so Kathy gave me a pickle pop. She goes, you're going to eat it too. I said, yeah, I am. I guess I asked for it, so I guess I should eat it. But it's more fun. And yes, it's still a hospital, and yes, it's still a clinic, and there are going to be people come in that aren't feeling well or have a little injury or have a problem. But they're there to try and make it as easy as possible, treat you in a very, very, very in a friendly way, but also to make you feel at ease. That's the whole idea, and they're really working toward that goal.
We
Yes.
are, and we pride ourselves on being clean and efficient, with a great level of care and the ability. The great thing about seeing one of our doctors at the clinic is that if you need labs, if you need an X-ray, if you need another service, you don't have to go anywhere. Just walk down the hill,
Yeah.
and we can take care of you.
Or roll down the hill if you want
Roll
to.
down the
but-
hill.
We
We
hope
can
not.
do that
There is
too.
speed bumps, so watch it.
Yeah.
Okay, but one of the things that Tiffin mentioned was showing empathy and also kindness to the patients. And, sometimes we get carried away in our jobs, and a lot of times doctors get kind of a little bit cold because they're going to so many patients.
Right.
But they're really working on not just, not treating you like just a number. And that's the big cities. They
Yes.
treat you, like a large number, well, they don't even know who your name is. They come in, they look at the chart, and then they come back 5 hours later, and they still don't know who you are.
Yes.
And that's how you're treated.
Yeah.
Been there, done that. All right. So that was a great report by Tiff, and I really appreciated that. And she is working on that dough run contract, working to get that back. And so if you have a company that needs to have services, blood drawn or different things done or physicals taken, contact Tiffin, and she can get that set up at your SMDH family clinic right here.
Yes, we can do everything that anyone needs, from home health to physical therapy, work comp claims. We can take care of your DOT physical. Anything you need, we can take care of
Great.
right here without having to travel.
Right here without having to travel. You don't want to have to travel at $4.29 a gallon. Hey, man, crazy. Okay, so let's go to the purchases. And Ashley, I'm going to let you explain this purchase here. I'm going to let you do it.
Sure. We have one item that was approved by the board, and that was a endoscope reprocessor. This is what our surgeon uses when he performs colonoscopies, endoscopies, and we use usually Dr. Voigt out of Rolla.
Right.
But that piece of equipment has to be cleaned manually after all uses, and we use a chemical which is called Sidex, which can be hazardous if not used correctly with the employees. We are one of the only facilities that still uses Sidex. It's very uncommon. That's seen in facilities nowadays, and it's not really recommended. So we have been approved by the board to go ahead and move forward with purchasing this reprocessor.
Which will clean all that equipment without the side X.
That's correct, and it'll be more efficient. We can clean a couple scopes at a time. It's just going to be safer all around for the employees.
Okay, that's 20,000 plus.
Right.
Okay, is that over a lease purchase?
No, we'll be
Gonna
purchasing that
straight out?
outright.
Okay, very good. All right, very good. And then the telemetry, they want to kind of see how that works.
We are going to have another demo set up. Our telemetry is a piece of equipment that monitors your cardiac status, and that's going to be the system that we have now. It's workable, but it's getting old and outdated, and the parts are no longer able to be replaced. They're not available. So once they're broke, we can't replace them. So
that's not something you want to hear when you have a cardiac problem.
Right, and we still have plenty of devices to use, but we just don't want to get to that point where we're having several break and we don't have what we need.
Time to make a change.
Right, and Ross from RHG, he works on the purchasing side of things, and he has found this unit. The board does want to see an additional presentation and wants to look at this system before we move forward, so we're going to do that, and then we're going to bring it back to the board in the future.
I think they want to see how they tie together. You were mentioning, between ED and med-surg and how that works, and I think they just want to see how it works. Which makes sense. If you're going to put out that.
Absolutely, it's not an emergent thing that we purchase, but we need to get on top of it before it becomes an emergency.
All right, very good.
And then
It's something we've
plan
discussed.
for it.
Yeah, we've discussed this. It's been in our capital budget on our wish list, I guess, so to speak, for the last several years. It's something we've known that we're going to have to replace, and it's just getting to that time where we just need to move forward with
getting
it.
Bumped. Yeah, it does
And
happen.
that's the only purchases we had.
Very good. The board went to closed session. Any votes taken that you know of?
I don't know of any votes off the top of my head. I
well, then,
apologize.
that's all
They
right.
gave Don the ability to be our acting CEO and act on contracts and easements without having to call the board all back together just to get a vote. So
Usually just deals with employment, things of that nature, usually
Yes.
closed session. So that or a change in some major function. So.
we have no change. We did have to have a reduction in staff, and we have no future changes whatsoever of reducing the staff anymore. We're at a good level.
Actually, we're hiring back.
We're hiring back, which is great, and we're looking to grow all of our services so that we can serve the community better. And with that, we'll be able to hire more people back on.
Yeah, and some of the things where people may not have been in a department that might have been overstaffed, and that's really probably one of the reasons why that they were let go, or actually asked to move to a different department.
Yes.
A lot of times that does happen.
And that's the goal. We're just trying to make each and every department in the hospital be as efficient as possible. So we have shuffled a lot of employees, and a lot of employees have taken on new roles. And so right now we've kind of got through that the first 90 days. We're now focusing on those changes and rebuilding the hospital and trying to make things function as best as can be.
Our employees have truly been our heroes and have been, just an amazing workforce and a group of people who have gone above and beyond to come together and worked countless hours to make things right so that we didn't have to look at closing our doors.
Very good.
Yeah.
Very good. Well, to both of you, thank you for all the work you've done, and thank you for the additional reports, the financial reports, because really, I'm hoping it's opening our board's eyes to a few things that they may just not have been aware of. And that's always, to me, that's always good news. So you can't, even if you're a board member, you can't be on top of every single thing in the hospital. There's just too many different departments, too many things going on. And when you put it all together and just see somebody for an hour and a half or 2 hours or maybe 3 hours in a night, hard to go through all that. Even though they do get information emailed to them, until you're on site and actually see what it is or get to talk to somebody in it, you just don't possibly get that feel for it.
Right.
Don't understand it. I'm not even going to ask about the endoscopes. I don't want to know what
You don't want to see that, do you?
That'd be very important that
I
it's clean.
experienced that in January. I don't really want to go back there. But, nonetheless. But we thank all our friends with Salem Memorial District Hospital, JoeAnn and Ashley, for coming in, spending some time with us. And if you have any questions about what you might have heard today or about your hospital, please call them. That number is 729-6626. And you can ask for them directly, or
Sure.
you can just go through the directory. You can just click the 0 to get to the new directory, or just wait for the operator and then ask, and they'll be more than happy to get you out there. Thanks again, ladies, for coming in and spending
Thank
some
you.
time with us.
Thank you very much.
It's been our pleasure to sit down with you and go over this information, and it's really been our pleasure to see the positive number coming
Absolutely.
out for our hospital. Stick around. We have civic happenings coming up. We have the Cardinal baseball a little over an hour from now right here on KSMO. Stay right here.
There's a place for do-it-yourselfers with everything for your car or truck.
Right now at K&H Auto Supply, get a Schumacher 1.5 amp battery maintainer for $44.99. 3-ton jack stands are $44.99 a pair, and Super Clean Cleaner and Degreaser is $11.99 a gallon. K&H Auto Supply, your Parts City Auto Parts store right here in Salem.
Parts City. Yeah, Parts City. Parts City.
Sometimes we push those health worries to the back of our minds, way back. But if chest pain, heart racing, or shortness of breath have been bothering you, bring them up front. Call a doctor. It could be a condition like atrial fibrillation. AFib can have other symptoms too and increases stroke risk about 5 times. This is no time to wait.
A message from Bristol Myers Squibb and Pfizer. Learn more at notimetowait.com.
If you're a SNAP user, Country Mart in Salem is doubling your food dollars. This is how it works. Buy fresh vegetables and fruit with your SNAP EBT card, and you earn an immediate 50% off the total amount of fruits and vegetables you purchase, up to $25 per day. Before you pay, please let your Country Mart cashier know that you would like to get the double up discount. For more information, visit tcmarkets.com, DUFB, Country Mart, Highway 3272 East in Salem. Good morning. It's now time for a look at our civic record. It is a program of church and civic news and a mention of persons recently deceased. Civic record brought to you as a courtesy of all of us here at KSMO Radio, 1340 AM and 95.7 FM. Billy Poindexter of Salem passed away on Monday, May 16th at the age of 79. Funeral services for Billy Poindexter will be held at noon today at the Wilson Mortuary Salem Chapel, with visitation from 11 this morning until service time at the chapel. Burial will be in the Cedar Grove Cemetery. Billy Poindexter, survived by his wife Eloise Poindexter of Salem. Children: Kimberly Martin and husband Dwight of Falcon, Missouri. Billy Poindexter and wife Beth of Georgia. Wilson Poindexter and wife Carrie of Salem. And Taylor Poindexter and wife Becky of Oklahoma. 12 grandchildren and 8 great-grandchildren. Brothers Terry Poindexter, Jimmy Poindexter and wife Mira, and Mark Harris and wife Pam, as well as a host of nieces and nephews. All the arrangements are under the direction of the Wilson Mortuary of Salem for Billy Poindexter, whose funeral services will be held at noon today at the Wilson Mortuary Salem Chapel. A graveside service for Joyce Akers will be held Saturday afternoon at noon at the Cedar Grove Cemetery. That's a graveside service for Joyce Akers, age 85, will be held Saturday afternoon at noon at the Cedar Grove Cemetery. Craig Edward Burton of Salem passed away on Monday in Salem at the age of 62. A celebration of life for Craig Edward Burton will be at noon Saturday at the Rolla Lions Club. Craig is survived by his wife Terry Berardi of Salem, children Misty and Gabe Burton, and stepchildren Nick and Zach Berardi, and extended family and dear friends. All the arrangements are under the direction of the Wilson Mortuary of Salem for Craig Edward Burton, whose celebration of life will be at noon Saturday at the Rolla Lions Club. The Shriners Vidalia onions are in. If you're interested in getting a 10-pound bag for $10, they're here. Call them at 247-6637 or 314-9555. 247-663-7980. That's 247-6637 or area code 314-954-7980. Now, these onions will also be available at the Salem Farmers Market this weekend. Check it out, the Shriners Vidalia onions. They are here. And check them out at the Salem Farmers Market. That'll be Saturday morning, 7:30 is when that gets underway. Come on out, check that out. And, of course, too, if you can't get to that, call them 247-6637 or 314 area code 954-7980, 954-7980. Salem Community Garden will be offering a variety of growing green educational workshops. The workshop for this Saturday is canning mixed vegetables. The garden's located behind the Salem Methodist Church at 801 East Scenic Rivers Boulevard, and everybody is invited. Whether you have a plot out there or not, you can come on out and learn about canning mixed vegetables at the workshops at the Salem Community Garden. If you need more information, call Charlie Grimm at 573-368-9902. It's 368-9902. Coming out to Creative Arts Center for the Spring Fest Arts and Crafts Show and Sale going on this Saturday, 9 in the morning till 3 in the afternoon, out at the Creative Arts Center. There'll be unique handcrafted gifts and home accessories created by our local artists. They do such a great job. Plus, they have many other activities out there as well. A kids' craft table, a food truck, so much more. It's Spring Fest Arts and Crafts Show and Sale. It's going on at the Creative Arts Center with the Spring Creek Artisans this Saturday from 9 in the morning till 3 in the afternoon. If you need more information, please call 247-0651 or 247-5306. Message them on Facebook or email Salem Arts Council at outlook.com. And the Salem Acoustic Jam will be held this Saturday evening at 6:30 at the Creative Arts Center. Come on out, bring your instrument and join in. It's being moved up a week due to the Memorial Day holiday. All types of music are played. Whether you're a beginner or seasoned pro, you're welcome. Come on out, participate. Sit in, play along, or just listen to music and tap your feet. There is no charge to attend. For more information, again, call the Salem Arts Council, 247-0651 or 247-5306.